How do AAAs present, and how do you assess an aneurysm patient? Most aneurysms are completely asymptomatic and the patients aren't even aware that they have them. Instead, they get picked up on ultrasounds done for the investigation of unrelated symptoms, for example, urinary tract symptoms. Some countries run national aneurysm screening programs for people in their mid to late 60s, especially those with a smoking history. An occasional patient notices a pulsation in their abdomen, and from time to time a patient presents with back pain caused by their aneurysm. How do we assess a patient who has an incidentally picked up or a screen-detected AAA? Well, as always, we perform a history and examination. Ask about back pain. Remember, most people have back pain at some point or other, so a patient with a chronic history of back pain can be reassured that their aneurysm is unrelated to it. But beware the patient with a recent onset new back pain and no history of spinal issues. This patient may well have a rapidly expanding aneurysm, and so they warrant urgent investigation and treatment. You also want to ask about abdominal pain, their smoking history, a family history, have they high blood pressure, and have they high cholesterol. You also want to try and assess their general level of fitness in the history. So do they have leg or chest pain and exercise? Have they a history of a stroke, a heart attack, or a coronary intervention? Do they have symptoms of heart failure? Do they get short of breath on exercise or in bed at night? Or do their ankles swell up? You should also perform an examination. Examination in a AAA patient involves an abdominal examination, making particularly note of any scars and whether or not the aneurysm is tender. AAA patients may have aneurysms elsewhere, so be sure to check and document whether or not the femoral and popliteal pulses are aneurysmal. And look for signs of heart failure. Do they have peripheral edema, a raised JVP, or lung crepitations? This may impact on their fitness for a potential intervention, if needed. You can get the written revision notes on vasculartutor.com.